When the Affordable Care Act was deemed constitutional last year by the U.S. Supreme Court, the court shot down its mandatory Medicaid expansion. The court said individual states should choose to expand the health care service, but Indiana has chosen not to. News 18's Kelly Roberts reports on what the state is doing and on a group of people fighting against it.
Dr. Robert Stone spent years working in Indiana hospitals' emergency rooms. He says he saw firsthand people coming in with conditions that could have been treated, but they did not come to the hospital until it was too late because they did not have health insurance. Stone says you can save lives by expanding Medicaid.
The economic case and the moral case for expanding coverage to 300 to 400,000 people who wouldn't have coverage is just, it's a no-brainer.
The Affordable Care Act allows for states to expand Medicaid, and the federal government will foot the bill for 3 years. Although Stone thinks it's a no-brainer, Indiana Governor Mike Pence has more thinking to do. Pence has chosen not to expand Medicaid, instead applying for an expansion of the Healthy Indiana Plan, an already existing form of health coverage for low-income Hoosiers. Stone and Mildred Williamson, a former member of the Illinois Department of Health, spoke in favor of Medicaid expansion to a group in Lafayette Saturday.
Many of us, in terms of framing social justice, look at access to high-quality health care like we need access to food, housing, a decent education.
Stone says expanding Medicaid can help cover about 400,000 of the 800,000 uninsured Hoosiers. He says right now, without Medicaid expansion and the installation of the Affordable Care Act exchanges, there is a group of people who cannot get health insurance.
The crazy thing is that if you make too little, you may be too poor to qualify for the exchanges, because the whole act was, the Affordable Care Act was designed to have the Medicaid expansion cover the poorest people.
Pence says expanding an already existing Healthy Indiana plan was in the best interest of Indiana citizens. He was granted the expansion in September by the federal government. It will be in place until the end of 2014 and expands enrollees from 37,000 to 45,000. Reporting in Lafayette, Kelly Roberts, News 18.
And News 18 reached out to local Republican state legislators. They were either unavailable for an interview or did not return our calls.